Okay, so welcome to today's webinar on the topic of picky eating and ARFID. When is therapy necessary? We're still waiting for a few attendees. We're very happy that so many people have registered for this webinar and are interested in this topic. My name is Dr. Sabine Marinschek. I'm a clinical psychologist and medical scientist at NoTube. I'm working for NoTube since over a decade, so I have a lot of experience with children with feeding and eating disorders, and I'm looking forward to answer your questions today. Special thanks also to my team who is hosting this webinar, Melanie and Cassie, Caroline and Marion, who will answer your questions in written form. In order you want to, so we have received many questions from you already beforehand, but if you have questions you want to ask today, please use the Q&A button at the right bottom of the page, and then we will take care of your question. Please make sure that you, if it is the case and we are not able to answer your question today because there are just too many, then please don't worry. We will give you the opportunity to book a free evaluation or to send an email to us after the webinar. Yeah, I will answer your questions today together with my colleague Eva. Eva, would you be so kind as to introduce yourself?
So nice to meet you. Hello. So my name is Eva. I'm a pediatric physiotherapist and educated as a boba therapist, Castillo Morales, sensory integration and upledger craniosacral therapy. I've been working with the founders of NoTube and our medical doctors since about 30 years. So I've been able to collect quite some experience also, and I'm happy to answer your questions, whatever I can't answer at the moment, or if it is too specific or some information is missing, we kindly ask you to write us an email or book another free evaluation. Yeah, thank you.
Yeah, so today we are talking about the topics of picky eating and of ARFID. And before we start, I want to briefly explain what led to the diagnosis of ARFID. Because some years ago, we didn't have any diagnostic possibilities for young children and kids with eating disorders. We had diagnostic possibilities for older ones and for anorexia, nothing for really small kids. And so some time ago, the DSM introduced the diagnosis of ARFID. And ARFID is, from our perspective, it is good that it exists, and now there is some emphasis on the topic of early feeding and eating disorders also in the medical community. However, ARFID is like, well, it's not very specific, because if you look at the diagnostic criteria for ARFID, you can find, for example, nutritional deficiency as a result of inadequate intake of food, or inadequate weight gain, or weight loss, or dependency on supplements or tube feeding, as well as social problems in eating situations. And if you look at that, this includes a whole lot of different feeding and eating disorders, because kids, the ARFID diagnosis is suitable for kids and for adults. That's the next thing. But kids who don't take enough food orally may have infantile anorexia or may be tube dependent, which are completely different phenomena and need different treatment. And also nutritional deficiency may occur in severe picky eaters, although they are not underweight, because they eat enough, and some of them are even overweight if their food choices are in the high caloric section. But for kids who eat a very limited range of nutrients, they may also be malnourished despite the normal weight. So today we are going to talk about your questions, which have been on many of these topics included in ARFID, and show different kinds of illnesses. So Eva, do you want to start with the first question, please?
Yeah, so before I take the first question, I would like to say something in general. This is when does my child need a treatment? Yeah. So this is the question a lot of parents have, and the easiest way to say, whenever you are concerned that the eating behavior of your child is different, or you are concerned about it, just look for a therapist, make an appointment, and then you are on the right side. Yeah, it's better you react earlier and have one therapy session than you're waiting for years, which a lot of parents did, because everybody said, oh, the child will grow out, and if they're going to the kindergarten, it will be better, and if they're going to the school, it will be better. And at the end of the day, nothing happened. Because if children really have problems with their sensory processing or sensory processing problems, they are born with that. So these problems don't disappear. Yeah. And the more parents are aware of what it is, how it is working, and how they can support the child, the easier it is for all of them. Yeah. And the older the children are, the more difficult it becomes to treat them. That's the one thing. The other thing is, when you look at the child, you are not allowed to look only at the oral development. When you look at the child, you need to look at it in total, because most of the things have an underlying problem, and one of the symptoms is the eating disorder. Yeah. So if your child, for example, has sensory problems, they can be shown as an eating problem, or they can be shown in other areas, for example, in very low attention phases. Yeah, so that children are not able to sit and focus on something. And then you have to work on these things. Yeah, so you never can look at an eating disorder isolated. Another thing is that you have to look at the developmental age of the child. When you have a child which has problems in general with the development, you always need to look at this. Yeah. So if the child, for example, has a developmental stage from their general motor skills of 6-7 months, yeah, then the eating development can't be further. Yeah. So these children, even if they are 5 years old and the motor development is at 6 months, then you will have an oral development also at this stage. Yeah, so these are the general things I wanted to mention first.
Yeah, sure.
So maybe Sabine, you want to
So I'm starting with one of the questions which came in, which may be interesting for all of you. It says ARFID is so broad. How can I tell what type or what issue my kid has, so we can target the problem? Yes, you're completely right. The ARFID diagnosis is very broad. And as said, it includes a lot of different feeding and eating disorders, starting from picky eating over infantile anorexia to tube dependency. So it is very important to get your child assessed by specialists which are really specialized in feeding and eating disorders and are experienced. I know there are not so many because it's quite a niche, but this is really important in order to help your child in an adequate way, because if your child gets the diagnosis of ARFID, it doesn't say if it has a sensory problem or if it got tube dependent. So basically is a victim of the tube feeding, of the prolonged tube feeding, or if the child has some interactional problems or psychological issues. Yeah? So this is a big difference and needs thorough assessment. Yeah. And the second question from this lady was, can all tube-fed kids who learn eating and are discovering the world of food be considered as picky eaters or with ARFID? No, not at all. They are not all picky eaters. Of course, they can receive the diagnosis of ARFID, but from our point of view, tube dependency is a completely is a phenomenon of itself. It's not really an eating disorder, but it's a reaction to a reaction to tube feeding, because the kid got a tube out of medical reasons and then just got dependent to it because it was fed all day long. So one cannot expect a child to learn to eat normally on a full tube feeding. So this is not a disorder, but just a reaction on a medical intervention. It's like if you put a plaster on a broken leg and you don't put the plaster off when the leg is fine. So the child will not learn to walk. And that's basically the same with tube dependent kids. So of course they also need specialized treatment and have to undergo a thorough assessment and tube weaning.
Okay, the next question. My daughter is 8 years, gone from eating fine as a toddler to very limited food, no tube. Possible ADHD. Yeah, that's what I said before. On the one hand, you need to look at this child in total. Look at the general developmental stage in all areas of the child, and if there is an ADHD considered, then you need to start to treat this, because this can lead to a feeding disorder, of course. If the symptom of the ADHD becomes too much, then of course you will also have symptoms in other areas of the development. In general, I know this child personally, so maybe the mom would like to contact me and send us an email, and then I can discuss it with her personally.
Yeah. Another question was, is there different degrees of ARFID, or are all children severe cases? No, of course not. And of course there are different degrees. Also for picky eating, of course there are some kids who are a little picky and some adults who are too. And it's also a pretty normal developmental phase to be picky for a certain time. So this doesn't mean necessarily that the child has a disorder. But there are some signs when you should look out for professional help. And this is if your child doesn't gain weight or loses weight, or if your child is malnourished and has certain deficiencies of certain nutrients, which can be checked by a blood count in most cases. And what is also very important is that if your child has social problems due to its eating problem. So if your child can't go to birthday parties or can't join any holidays or go away with friends because they are not able to eat anything there, then it is really time to seek for professional help.
The next question was, my son is 21 years old. He has a feeding tube his whole life. NG tube for 5 years, then got G tube at 5 years and still has it. Been in feeding therapy from birth to middle school. Eats a little bit by mouth, but very slow. He had swallow studies, all is good. We are starting vital stim therapy soon. Can you offer any advice for this age? Should I attend this workshop? Yeah, okay. Hopefully the mom is here. I think it's no difference if you are 5-year-olds, 1-year-old, 21 years old, 50 or 70 years old, if you have a feeding tube. Of course, the older you are, the more difficult it is to be weaned off the feeding tube. But it seems that this young man is able to swallow. It would be interesting to know what kind of underlying diagnosis he has. But at the end of the day, tube weaning will only work if the tube feeds are reduced in the right way during the wean. If this is not happening, you're just coming to a certain point where children or people are taking a certain amount and then they got stuck in the therapy. So I would ask you, probably you can book a free evaluation with my colleague and to get more information about what would be possible for your son.
Yeah. Eva, a question came just in, which is perfectly right for you. Could you please explain what is sensory integration disorder and its main symptoms, how to spot it?
Okay. Well, let's say, from the when we look at us as a person, we have a motor development and we have a sensory development. Sensory is connected to everything. How do we feel the boundaries of our body? Do we feel our fingers? Do we feel our toes? Do we feel our knees? What happens if somebody is touching us? If he's touching us soft, if he's touching us firm, what is easier for us to tolerate? Yeah, and it's a system where we have somewhere on our body we have a lot of receptors, and these different receptors lead the input which is coming to the brain, and in the brain it's translated so in that way, and then we understand what is happening. And if one of these components is not working in a proper way, like for example the receptor, or the way from the receptor to the brain, or the translation there, then we're having something like a sensory problem. Yeah, we are feeling things in a different way, and it's not only on our from our boundaries, it's also from smelling, from tasting, from hearing, from seeing. Yeah, so some people are very sensitive to noises, for example. Some people are very sensitive to smells. Yeah, so they smell just better than we do it, and that's the problem they have. Yeah. Okay.
Yeah. And symptoms are like children who don't want to touch certain textures, who are not able to walk on grass. These are and who are very sensitive to smells and tastes, right? So yeah, we often see, so I would say about more than half of the kids who come to us have sensory problems, but often it is not recognized by the treatment team at home or by the parents, because they simply don't know anything about it. Yeah, another question for tube weaning. How would you describe the process of weaning for an 18-month-old? What should the parents expect? What is the weight loss parameters we should expect? Okay, at this stage, maybe I explain the tube weaning options we programs for tube weaning. One is the net coaching, which is a completely internet-based program, and the other one is the eating school, which is a 2-week on-site program in Graz, Austria, followed by telemedical aftercare. We see about 200 kids per year who we wean from the feeding tube. So we are, I think, the largest weaning center worldwide. Yeah, because we do only that. So we do only feeding and eating disorders and nothing else, which is something most hospitals cannot do because they have many other duties. Our tube weaning works in the net coaching. You are in daily contact with our specialists. Each wean is guided by a medical doctor, which is available every day, including holidays and weekends, a clinical psychologist, and a feeding therapist. So you have a team of 3 specialists who accompany you on a daily basis. We do a lot of video analysis. We advise you how to feed your child, what to feed your child, which position is best to feed your child, which food you should give, how you should reduce the tube feeds, because as said, a child on full tube feeds cannot learn to eat because it is nauseous all day and full all day, and there is simply no reason for them to eat anything. So we reduce the tube feeds very carefully, and this is a very individual process. So the reduction of the tube feeds is based on individual parameters like the age of the child, the underlying medical condition, the weight of the child, and the pre-existing oral skills. So this is not something like a program we go through with every child, but it is very individual, and Every child receives this very own plan for tube feed reduction, and it is adjusted on a daily basis. So it's not like you go to an appointment once a week, but you're in contact with us on a daily basis until your child is completely off all tube feeds for more than 1 month, for 35 days, no matter how long it takes your child to get there within the time frame of 6 months. So this is the net coaching, and the other option is the eating school, where you come to Graz for 2 weeks for intensive therapy, where you are seen by our specialists every day from 9 a.m. to 6 p.m. with a lunch break. And you start with the same group of people, 10 families all together, and we have 3 play picnics per day, so we eat together 3 times per day. And in between, you have a lot of groups and individual sessions with our therapists. So it's quite an intensive program. And after that, you go home and you will be accompanied by our team telemedically until your child is completely weaned off the tube, which may already take place in Graz, or maybe it just needs partial tube feeds when it goes home. Yeah, so 18 months of age is a very good age for weaning. So the most of our kids are between the age of 9, 10 months and 5, 6 years, I would say. But we also have younger children from 8 to 3 months. And we also have older kids in the eating schools up to 13, 14 years. So this is, and of course we adjust our groups and our therapies to the age and the developmental age of the child, which Eva already mentioned, which may differ from the real age, of course, in kids with medical issues.
I have a question now from parents from the Netherlands. 1-year-old delayed feeding developments. Can she still learn, and what food is the best to start? So if the feeding development is delayed, also the rest of the development might be delayed. Yeah. So I don't know anything about this child. Can she still learn? Yeah, of course she can learn, but how much she can learn depends on the general development. Yeah. So that's nothing you can answer in this way, and there is no kind of food what is best to start in that way. I don't know if this child is in a feeding tube or if this child is only fed by bottle or puree. Maybe the parents, if they can hear it, can contact us and then we can talk about it. Yeah. Question. My daughter is very low functioning. I feel she does not have the capability to swallow. Would your program be for her? This is also a question where I guess the child might be on a feeding tube still. Yeah. And swallowing is a way either you can swallow or you can't swallow. Yeah. And most of the time it's not about swallowing and swallowing difficulties. It's about to bring the food back. Yeah. Because a lot of children have a tongue which is not moving. Yeah. And when the tongue is not moving, it's very difficult to get the food back. They would be able to swallow, but they don't get the food back. Yeah. So it's up to the therapist to look what kind of feeding tool and what kind of position and what kind of texture they need to use that the child is able to swallow the food. Yeah. So probably if you would like to have more information, please contact us.
Yeah. Another question is about a 22-month-old son with autism and who is fully dependent on G and J tube feedings, nil by mouth. Yeah, so kids with autism we see a lot, either on feeding tubes, on full tube feedings, or because they're picky eaters, which is part of their diagnosis, that they are not very open for new things. And of course, autistic children need special attention during the wean because they are not like they are not so attracted by social eating and social situations. So we use other techniques to help them learn to eat. But fortunately, we have very good results also with kids with autism. Some of our experts are specially trained for the treatment of autistic children, like Cassie has done the education. And so we take special care of these kids, either in the net coaching or also in our eating school, in order to help them learn to eat and sustain themselves orally, or broaden their food intake.
Okay, the next question is, I have a 5-year-old with Down syndrome who is still eating purees. He gags on soft solids and then refuses eating anything. We have tried gradual transition, swallow studies, food therapy, all to no avail. We're just wondering what you would recommend for us to try next and find successful. It depends on how your 5-year-old is developed, what are his general motor skills, how is his general tension, is he eating the purees by himself? So that would be an important step for me. Yeah, if he's eating all his purees by himself, then he is able for the next step. Yeah, because then he can take solids, and if he is able to take the solids and deal with them in his hands, then he can put them in his mouth and handle them. Yeah, so the next step would be, I guess, eating purees on his own, and after that he might take and start the solids. Yeah.
Yeah. Another question is from a lady from the UK. Does my daughter need therapy, and what do you offer? She has a gastrostomy and has never eaten with her mouth more than a few licks here and there. She's already 6.5 years old. Yeah, as explained, this is a case for our tube weaning programs. In order to qualify for our programs, one has to undergo our medical assessment, for which you can register yourself on our homepage. And this assessment includes a video analysis of your child surrounded with food and drinks and in a play situation, and the upload of all medical records of your child, as well as filling out a specialized questionnaire on different topics, from birth to nutrition to information about the feeding tube, about the social situation, and so on. And this you can upload on our homepage, so you don't have to see us in person, and you can do it in your own time frame. And as soon as you have uploaded all these documents, the assessment is evaluated by our medical experts. It's always one of our medical doctors, pediatricians, and one of our therapists, and we go through every detail, and then we decide if your child is suitable for the treatment with us. And then you get the response, and then afterwards you can start the treatment. For the net coaching, we don't have a waiting list, so you can basically start right away. You have received the positive results of your assessment. And for the eating schools, we have 9 2-week courses per year. The dates you can see on our homepage. Another family is asked how our availabilities are this summer. You can check that on our homepage. Would any of my colleagues be so kind and to send the link for the dates in the chat, so you can have a look when eating schools will take place. Just make sure to register on time, because of course they are booked out pretty soon. The next eating school is already full, starting by the end of February, but of course in the later ones we still have some spots. And to book a spot, it is necessary to do the assessment and then register for the date, and as soon as we have received partial or full payment, then your spot is reserved.
So the mom has answered about the child with the Down syndrome. I answered the question before, and she said, no, he's not eating purees by himself. He has high sensory issues and can't stand the food on him. We have been trying, but it's a struggle. Is there something I can do to work on his sensitivity issues? Yes. So a child only can start to chew and handle solids and semi-solids when they are able to take it in their hands, yeah, because there is a very tight connection between the oral motor function and the function of the hands. This has already been during pregnancy, and all these children with difficulties with the sensory issues and being in contact with food, if they can't handle it on the hands, you can never ever can handle it in your mouth, yeah. So you need to work first a lot on the sensory issues with the hands, and then he can make the next oral developmental step. One of the moms was asking, my daughter has not used her tube since January the 1st, 2020, but is still needing prompting to eat and any decent amount of food. So there are a lot of children, like grown-ups, who are not that interested in food. Yeah, they are not that interested in eating. They're just eating because they need to eat. They forget to eat all day long, and then in the evening they realize, oh, I'm hungry, I didn't eat that much. And on the other hand, you have people who like to eat and love to eat. Yeah. So if you like to eat, it's very difficult to understand persons who don't like food. Yeah. But you don't need to feel sorry about them. It's just they're not interested in the food. Yeah. And there are a lot of children, especially sometimes very early born preemies. Yeah. So these extreme preemies, they often are not very interested in eating. And these are children, who need to get a schedule for eating. Yeah. They probably, because they just forget about eating, they don't feel the hunger. So you will need to set up a schedule for them, and you will need to have more small portions with high calories than 3 larger portions with low calories. Yeah, so that's something where you should always be aware.
This leads us to the next question, which is a very good question. What should be in a standard diet, and what is the definition of a picky eater? Well, in a standard diet, it is important at first that you have all the macronutrients. So you have fat, proteins, and carbohydrates included. And of course, there are also micronutrients like vitamins, iron, potassium. A question which always arises, and I think we even got some of us, one of them in, is about eating vegetables and fruits. And I can assure you that this is something which seems important, but is the least necessary, because vitamins are one of the things you can very easily substitute. So you can have drops. There are even gummy bears with multivitamins at this stage. So nobody in our Western world has to eat vegetables or fruits if they don't want. It's way more important that the child eats protein and carbohydrates, because this is something you cannot put into drops, you know. So I know that fruits and vegetables are considered as healthy in our Western world, but we have to well, for the body, it doesn't really matter if it comes from fresh fruits or from vitamin supplements and so on. So this is not the most important thing. A picky eater, a pathological picky eater, is considered a child who eats less than 10 different kinds of food. Many kids, I would say, most of the kids we see eat less than 5 different kinds of food. Some of them even only 1 or 2 different kinds of food, or they're completely dependent of supplemental drinks because they don't accept anything else. Picky eating may be related to the texture of the food. So kids who, for example, only eat purees, even even though they are developmentally able to eat solids, and they're maybe already 4, 5, 6, 7 years old, but still rely on purees. But it may also be related to the color of the food. We see a lot of kids who only eat white foods, which is not so bad from a nutritional point of view, because then you can have milk and rice and white meat and so on. But of course, it's also a problem from a social perspective. Some children rely on special brands, so they only eat one yogurt of one special brand, and if they can't get it in maybe on holidays, then they freak out and eat nothing. So this is also a common thing. And flavor is, of course, also something picky eaters really tend to be specific about. So, for example, kids who eat only sweet things, they would not ever touch savory food or anything else. So if your child eats so little food and maybe is even malnourished or has social problems, then it is for sure a pathological picky eating. But it's not like a child doesn't like to eat apples, then it's not a picky eater, because that's pretty normal for kids. But if your child only goes for like chicken nuggets and chips and one kind of juice, and that's everything they eat all day long, and they don't accept anything else, then of course it is considered as picky eating, which needs treatment.
Okay, so here is one question from a mom from the US. Can you give us an overview of what goals for picky eaters should look like for different age groups? For example, my daughter is 16 months adjusted age, eats a limited variety quantity of food. How can we support her best at this age? In general, it's not connected to the birth age. It's only connected to the developmental age. Yeah, that's what I said already before. So we need to know what is the child able to do from the general motor development. What is the child able to eat? So I don't know what this child is able to eat. If this child is able to eat purees, if this child is eating by itself already, if this child is taking semi-solids in his mouth, starting to learn to chew, spitting it out again, which is just a physiological procedure. And if you want to, it depends on what you see as a limited diet. Yeah. As Sabine said already, if you have 3 nutritions, then it's becoming difficult. But if a child with 16 months, they have a more limited diet than older children, for example. Yeah, it's just important that they are moving on, and it becomes difficult when they're only taking food from one brand. Yeah, if they're taking food from one brand and they really recognize it, even if you put it in a bowl, then it starts to become difficult, because then this child is very sensitive. Yeah, if you have normal purees and the child likes one taste, you can start to mix any other kind of taste a little bit in this puree and start to go ahead with that. Okay.
Oh yeah, another question from my mom. My son is 13, and we were just mentioned that he may have ARFID. My worry is the medical problems he could face: heart, his organs, eyesight, and so on. No energy, constant tiredness, development of bones. He doesn't eat any vegetables. Yeah, as said, one has to do a thorough assessment on nutritional and psychological and sensory issues in order to find out which therapy is suitable for your son. As he is already 13 years old, of course, it is also important that he wants to change something. If he's really in a medically compromised state already from his picky eating, then of course one needs to act and help him with supplements or something else. I cannot tell you exactly because I don't have the data of your child, but if you are interested to talk about the specific case of your child, please feel free to book a free evaluation with one of my colleagues. Just to explain what the free evaluation is, this is a 20 minutes call or phone or Zoom call where you can describe your situation to one of our therapists, and afterwards they will tell you which options you have in order to receive treatment with us, and what steps you have to take to get registered and start treatment with us. This is free of charge, so please feel free to use this option. The link where you can book it is in the chat section already. So I would recommend for this mom that she books an appointment with one of our therapists and discusses the case of your kid and how we can help him, because of course I fully understand that you're desperate and really worrying about his well-being.
Here is the question of a family from the Netherlands. How do you see the environment influences combined with food? I mean by this, do you have experience with children who are so hypersensitive that they suffer from environmental influence? Our son is a child of 6 years who has ARFID. The tension is too much for him. He is now vomiting again. Yeah, we have had a lot of children who just need to leave the room because when they see the food or they smell the food, it's far too much for them. Yeah, so you need to work on that. It's possible to work on it, but of course it's very difficult for these children and also for these parents. But what we are doing in our eating schools, we are also learning the parents to understand what is going on so that they are able to make the next steps with their child, because this is something which there is no therapy in the world which can stop it. Yeah, it will be a process, and parents need to understand and to learn how to proceed and how to help their child. So there was also a question about payment of our treatments and insurance. So in general, after you have gone through the medical assessment, you can download the documents for the insurance and send it to them. In all countries, these are single decisions. It depends on your personal healthcare system, if the insurance is covering it or not. But we have cost coverages from most of the countries. Yeah.
Yeah, exactly. And as Eva said, the eating school is not only a therapy for the kids, but for the whole family. So also the parents receive a lot of trust. Also, if siblings are allowed to come, yes, generally yes, of course, they can also join the eating school. And the eating school is not like a hospital, but it's more like a kindergarten. We are not dressed in white coats or something, but because most of the kids we treat, they have already been in hospital for a very long time, so they're quite traumatized by medical treatments. And so we try to make the surrounding for them as child-friendly as possible. Yeah, so another question was also about traveling and housing at the eating school. Travel expenses are sometimes covered by your insurance. This is something you have to check beforehand. For the housing, there is a list of apartments and hotels we recommend nearby the eating school. Of course, you can receive them, this document from us. And yeah, so if anybody is interested in visiting our eating school, you will receive all the information beforehand.
The next question comes from a family from the UK. My 16-year-old autistic daughter has been tube fed for the last 14 months. Looking for help to get her back to eating again, currently only having orange juice orally and medications. So we are happy to support you, of course. Please just contact us. Yeah.
Another question from the UK is, my daughter has a severe genetic condition and is able to take only pureed food. Want to ask, is there any therapy that can help her move from pureed food to solid food? So yeah, we have a lot of children with genetic conditions. It's one of our largest diagnostic subgroups. And we have children with very, very rare diagnoses, which only exist a few times in the world. And also kids with more common genetic syndromes. Either they have a feeding tube or they have another kind of feeding disorder. If your child is able to transit from puree to solids depends on a lot of variables, like Eva already said, depends on the general development and the motor development. But we also have a lot of kids in the eating schools who can't make the transition from one texture to the other. For example, kids who stay on liquids only and can't get to the purees, and like in your case, kids who are not able to go from purees to solids. So this is something we're very familiar with, and we take care of in our eating schools by hands-on therapy mostly.
There is another question from the UK. How much can picky eating be overcome through time and positive exposure versus intensive therapy session? So from my experience, what I can say is if you have a sensory problem, you have the sensory problem. It doesn't go away. Yeah. So what we have seen, or what I have learned from older persons, is that some of the fathers from our children have also been picky eaters, and they started to take a little bit more food when they become older, like 20, something like 20 years old. Yeah. But there are also, of course, grown-ups who never managed to have a better variety, and they are suffering a lot, especially in social aspects. Yeah, it's quite easy for them to have the food and they can eat it, and that's everything, that's fine. But when it comes to social events, it becomes very, very difficult to them. Yeah, and I think, I'm not sure what kind of, it's not about intensive therapy, it's about parents need to understand the underlying process and how to deal with it and how to make the next steps. Yeah, because then they can do it also at home. Yeah, so you don't need to go to a therapy every single week. Yeah, you just need to have you have an education first, that you understand it, and then that you can deal with it on your own. Yeah, and from time to time visit a therapy.
Yeah, children don't really like going to therapies we as adults think of. So it's not easy for them to go to a therapy like every Tuesday from 10 to 11, because sometimes on Tuesday at 10 they are maybe tired, and sometimes they are not interested, and sometimes they simply want to do something else. So this is why we in our eating schools don't have those fixed schedules you maybe used from hospital stays. So as we eat with the kids 3 times a day, we have a lot of time where we can interact with them. But we try to fetch the children in the moment where we think they are ready for something. Because if the child is sleeping at 10 a.m. in the morning, there is no sense of doing any therapy, because then it is tired. So we try really to catch the kids in the moment they are able to learn something, they're in a good mood, or they are ready to do the next step. This is the good thing about the eating schools, because we are a group of people who start the eating school together and who ends the eating school together. So there are a maximum of 10 families attending, and the same therapists accompany you every single day. So we really get to know you and your family and your kid and can work with them intensively, and you don't have to wait for a special appointment or something like that, but it all happens just naturally, because children are they're not living like we do after the clock, so they're not scheduling yet their day after the clock, but after their needs, and that's what we are trying to respect.
So there is another question. My daughter still struggles to chew. We don't know how to teach her. Only recently she came off the bottle. She is 3 years old. We still need to heavily puree all her meals. She's doing better and better with drinking, but food is an issue. Is there any way to help her to learn to chew? So this little girl was drinking bottles for 3 years. So this is a delay in the oral motor development, and I'm not sure if there is also a delay in the general motor development. Yeah. Drinking a bottle. So when she starts to eat purees now, then she's making the same developmental way like every other child in the world. Yeah. So even if she's 3 years old from birth age, her developmental age is about 8 months, 9 months. Yeah. And then it's quite okay to eat purees. Yeah. So if she is, I would need to know what she's able to do, from her general development. But for sure, it will take some time until she comes to solids and is able to start to chew. Yeah, because the next step is, yeah.
Mom has answered in the Q&A question.
Lovely.
Yeah.
Okay.
The section.
Okay, thank you. So I've seen you answered me in the Q&A section. That's lovely. Yeah, I think it's great that you managed the step from the bottle to purees, and please stay with the purees. There is no reason to make any pressure. The girl has cerebral palsy, so I don't know what she's able to do on her own, how her motor development is. But having purees is absolutely fine, because you can put in everything and she is well nutritioned. Yeah. Okay, she's completely non-mobile at the moment. Okay, so then the purees are a great step, and stay with this step. Yeah. Thank you for answering me. And if you have any further questions or want to discuss it in detail, please send me an email. Yeah. Okay. Yeah.
Yeah. Just checking if we still have any questions left. If you still have any questions, please put them in the Q&A section.
So I have one question here. When one child has ARFID, is it normal for another sibling to copy that behavior? Yes, of course. Yeah. And that's sometimes very difficult for the families. Yeah, children are copying it. That's it. It's quite normal.
Another question, also from the UK, is how long does it take a child start eating orally and independently? Well, that very much depends. If we are talking about tube weaning, most kids need, well, it's hard to say because we don't give the time frame, but most kids need around 3 or 4 weeks to go from complete tube to oral feeding. But of course, afterwards, as Eva said, they have to catch up the whole eating development they have missed. Because if you think of a healthy child, it takes about 1.5 to 2 years to go through the whole eating development of drinking from the bottle or breast to eating solids independently. And if a child hasn't eaten for 3 years, it has to catch up this whole development at an age which is not the normal age to do so. So of course they also need time after the tube weaning, when they have learned to eat, to catch up all those skills, because the oral region has not been used for 3 years. The muscles are underdeveloped, so it needs a lot of training for the kids to start eating solids. And it's also fine if kids who undergo a tube wean start with liquids for a certain time and then proceed to purees and later on to solids, because as said, they have to catch up the whole eating development they have missed over years. So this question is not really easy to answer, but for the tube weaning itself, so to transit from complete tube to oral nutrition, it takes a couple of weeks mostly, depending on the child's situation.
There is another question from the Netherlands. What are the methods to determine extremely picky 3-year-olds to eat alone? How to take out TV, tablets, phones during meal times? How does being in a new environment, daycare with new people, the lady and kids there, influence the eating behavior? My daughter vomited every day for more than 2 weeks, and I took her to daycare. So if you have an extremely picky eater, you have to look again at the general development, if the child has other sensory difficulties. And using distraction like a tablet, a phone, something like that, is absolutely normal for children who have a very low attention period. Yeah. So it helps the children to stay focused and stay here so that you can feed them. This is something you cannot, normally you would say, okay, a child is not allowed to look TV or watch a video or something, or read a book or play with something during eating. But with children with sensory difficulties, it's not an educational thing, it's a therapy. Yeah. So if you need to take it out, or if you want to take it out, eating already needs to work, and you need to make sure that your child is able to stay at the table and to sit, yeah, that they can eat. Yeah. Of course, a new environment and new people have influence on the eating situation. And if the child is very sensitive, of course, this can start to vomit when they go to daycare. Yeah. So I think the process to bring them there should probably be a slower one. Yeah. That was my last question I have on my document.
That's pretty much on time, because we are almost through our 1 hour webinar. So thank you very much for your interest in this important topic, and for your participation, and for sending us the questions. I really hope that you got some new insights and information. And as said, please don't hesitate to contact us of your child by booking a free evaluation or writing us an email. As said, you find the contact information in the chat section. And thank you very much from my side. It was a pleasure to answer all your questions today, and I hope to hear from you, and would love to help your kid to make further steps in their eating development. So thank you from my side.
Thank you also from my side. It was a pleasure to talk to you. Whenever you have a question, we are happy to answer. We are happy to discuss your personal situation. And have a nice evening.